High-quality photos that accurately capture your patient's dentition and occlusion are an essential component of the treatment process. Submitting quality photos enables Align technology to properly evaluate the impressions, as well as to accurately set the initial bite for your Invisalign ClinCheck treatment plan. The tools and materials you will need are a digital camera with a minimum of 5 megapixels, as well as optical zoom and preferably macro focus capabilities. Cheek retractors for use with the anterior and buccal photos. Articulating paper, a dental examination mirror, and an occlusal photo mirror for the occlusal photos. Please note, if you are using a point-and-shoot digital camera, we recommend that you disable the digital zoom. Please refer to your camera's user manual for further instructions. Begin with the extraoral images. Include frontal repose, frontal smiling, and right profile photos, reminding the patient to keep their bite closed during this process. Position the patient approximately 3 feet in front of non-distracting, neutral-colored background. When taking the frontal photos, position the patient so they are facing the camera. Fill the entire frame with the patient's head and neck as shown here. Then have them smile and take the frontal smile photo. Turn the patient to their left to capture the right profile photo. If the patient has longer hair, have them pull their hair back to expose the entire jawline. Let's move on to the required intraoral photos. There are 5 required intraoral images: frontal anterior, right buccal, left buccal, upper occlusal, and lower occlusal. For all intraoral photos, make sure the patient is seated in the dental chair with their head resting on the headrest. Begin with the frontal anterior image. Place a cheek retractor in each side of the patient's mouth and have the patient hold them while biting down. Position the camera with the midline centered in the image and so that the buccal surfaces of the molars are visible on both sides. The right buccal photo is next. With both cheek retractors in the mouth, have the patient bite down, then pull back on the right retractor, while relaxing the retractor on the opposite side. Assist the patient with retraction if needed. This will allow more of the molar region to show on the patient's right side. Position the camera perpendicular to the buccal segment. If there are issues exposing the second molars in the buccal photos, the use of narrow, more V-shaped retractors may be needed. Repeat the same process for the left buccal photo. In preparation for the occlusal photos, submerge the occlusal mirror in warm water to help prevent fogging. Before taking the occlusal photos, marking the occlusal with articulating paper is recommended. The visible contact points from the articulating paper will help your technician accurately set the initial bite on your treatment plan. Begin by drying the teeth thoroughly. Then, have the patient bite down on the articulating paper, making sure the paper is far enough back to mark the contact points on the molars. Repeat on the opposite side of the mouth. Inspect the occlusal surfaces to ensure that the marks are clearly visible before moving on to take the occlusal photos. Pull the upper lip away with retractors. Next, position the warm occlusal mirror at the rear of the upper terminal molar, while the front rests on the lower incisors. Have the patient hold the retractors as shown. Position the camera at a 60-degree angle from the mirror's surface before taking the photo. Repeat the same process on the lower arch. Insert the lower retractors. Position the occlusal mirror at the rear of the lower terminal molar while resting the front of the mirror on the upper incisors. Again, have the patient hold the retractors as shown. Position the camera at a 60-degree angle from the mirror's surface, compose the photo, and take the shot. As you can see in this repose photo, the patient is in the ideal relaxed closed position, 3 feet from the wall. A subpar image like this one has a hard shadow behind the patient. This is a good frontal photo. In this photo, the patient is tipping their head, which is unacceptable. Again, make sure the patient is looking straight ahead. This is a good anterior photo. This image does not pass inspection. It is very important to check the quality of each image before moving to the next position. When evaluating buccal photos, make sure the relationship of the first and second molars are visible as shown here. Reject any images which do not show this relationship clearly. For buccal photos, the camera should be perpendicular to the buccal segment. You should see both the upper and lower first molars, but little to none of the opposite upper central incisor. Images like this should be discarded and the photo retaken. Make sure the arch is completely visible and the mirror is fog-free before taking occlusal photos. Make sure all the images are clear and in focus before ending the photo session.